So we're going to talk in this second clip about immunity and epidemiology. So this is the same slide we had before, basically looking at the difference in rates of transmission depending upon how much immunity you have in a population. So at the top, you see that case where you have sustained transmission because none of the individuals in your population have any immunity to the disease. And that's how you can get these very fast rates of transmission and sustained transmission. As opposed to, again, on the bottom, where we have individuals in the population who are immune, and in that case, then transmission will be stopped, and that will, of course, protect other susceptible people in the population. So when you don't have immune individuals, you unfortunately get that top case where you can get really high rates of sustained transmission. And this can lead, of course, to epidemics or even in extreme cases to pandemics, right? Like we're seeing right now with SARS-CoV-2 and COVID-19. Now this slide should be familiar to you because it's from our population ecology lecture. And we've been talking about the different ways in which populations of a species can grow throughout the class. This is talking about exponential growth, right, which is when a population continues to increase at some fixed rate. And sustained transmission of viruses can follow this type of growth trajectory, as we'll see in later slides. We know, however, that for natural populations, this exponential growth doesn't continue forever, and that at some point there will be factors that will limit that growth. So when we talked about this before, we looked at a much simpler case than viral growth. We looked at the case of pigeons coming into cities, and when they first arrived in locations, they would show this type of exponential growth, and then eventually they would top off and reach a carrying capacity after they'd been in a city for a certain period of time. Right now, we aren't so worried about pigeons in our cities. We're much more worried about viral transmission and the disease it can cause. So this graph is showing you the exponential increase in confirmed cases of COVID-19 in Illinois, starting with the first confirmed case earlier this month. And this is actually showing you not just necessarily the virus increase itself, right? Because we've also had increased testing over time. So there's a number of different things that are occurring that are creating this exponential growth in confirmed cases. If March felt kind of like a wild ride to you, that's kind of what exponential growth feels like, right? So a sustained rate can sound very stable, but the numbers get pretty big pretty quickly. Now, public health officials are, of course, trying to slow the spread of the virus, and what can be done to do that? So before we talk about that, I want to talk a little bit about disease terminology. So in this case, the disease agent would be SARS-CoV-2, which we've already talked about, which causes COVID-19. And we are the hosts in this case. So the host is the organism, or sometimes it's just a cell type that's capable of supporting a virus or pathogen. So in the case of this virus, that would be us. The carrier is an individual of the host that is infected but shows no to few symptoms. So this is an important thing to know when we think about spread, is this concept of carriers in the population. And this is particularly important for young college students like you, because you may be more likely to be carriers, because carriers, again, are these individuals who are infected but show few or mild symptoms. And it can be really difficult to stop the spread of viruses if you have a higher proportion of people who are carriers in the population. And that's just because people feel fine, right? So they feel okay, and so they even though they have an infection, they go about their daily routines and they're not really realizing that they may be shedding virus as they do this. So another important aspect of disease spread is to understand immunity, right? So diseases will spread, as we've already seen, more slowly if well, first of all, an individual is resistant if they have immunity, right? And then also it will spread less in the population if there's a higher proportion in the population that have immunity. And immunity in this case, we're defining very broadly as just being someone who's resistant to infection. Okay, I know there's a lot of information on this slide, and I just want you to understand that there are basically two systems. And when we talk about things like vaccines, we're talking about developing adaptive immunity. Okay, so let's dig down a little bit into these two systems for the immune system. So the first is the innate immune system, and this just basically protects you from disease in a very generalized way. And then we'll talk about the adaptive immune system as well. The great thing about the adaptive immune system is it protects you longer term from the very specific diseases that you've been exposed to. So you can see there's a lot of different pictures on the left side for innate immunity, but I'm just going to focus on the top one, which is basically your skin. Okay, so there's some microbe, it comes and your skin protects you. So this is part of an innate immunity, right? And it protects the rest of your cells from, in this case, the microbe. So when you take a shower or you wash your hands, the microbe doesn't get into any of the other cells. So we have these kind of innate responses, but as you'll see, those are very generalized to protect us. In contrast, on the right side, we have adaptive immunity. So adaptive immunity is the way our body physiologically responds to a disease. And then you can see all those little red Ys. Those are actually the antibodies, right? So your body can learn what a disease looks like, and then when it gets exposed to it again, identify it very quickly and get rid of it quickly and keep you from getting sick a second time. So you may if you have little kids, you may have noticed that they get sick a lot, and that's partly because they're developing the adaptive immunity, right? So a lot of these things is their first experience with a disease, and so they'll get their runny noses and everything, right? And then the second time they'll have all those great little antibodies and they won't get sick. So basically, you can think of adaptive immunity as a way that your body learns over the course of the infection what it looks like, and so it will quickly and effectively respond to that disease if you're re-exposed. This also ties into vaccines. So part of what vaccines do is they develop your adaptive immune system. So these two types of immunity, we can also see that they take place over various periods of time, right? And so let's break this down. So in terms of your innate immunity, it's going to happen minutes to days. It's pretty limited in how specific it is to pathogens. It's pretty much constant, right? And then its kind of weakness, if you will, is that it's always the same, right? So your second response is going to be the same as your primary response. Adaptive immunity is different, right? So one thing is how long you have those antibodies, how long you have that adaptive response can depend on the pathogen. And that's actually part of what they're really working on right now. We would really love to know, okay, once you've been exposed to SARS-CoV-2, and you have adaptive immunity, how long is that adaptive immunity good for? Okay, we don't know that yet. Sometimes, right, it can be lifelong. Sometimes it can be very short periods of time. Okay, so it's much more selective. So the beauty of adaptive immunity is it's able to detect that specific disease organism. And this means that it improves over time, right? So as you get exposed, your system gets better. It's basically kind of like learning. And what this means is that it's more rapid and more efficient at detecting and killing disease with a second infection. So by now you've probably figured out that the population dynamics for viruses are going to be a little bit more complicated than for pigeons, right? Because you've got the whole host and you've got transmission, lots of various factors. And so you can see these layers of complexity here in this epidemiology triangle. Basically, epidemiology is the science that looks at how disease spread in a population. And you can see there's these three big groups, right? You have your agent, which in this case would be the virus. You have your host, and you have all of that variation within the host, right? So part of what we've been seeing in the news is, of course, people who have different immune statuses or different ages, different cultural practices. All of these things will influence the susceptibility of the host to the disease. And then, of course, you have the environment, right? And you can see within the environment things like crowding, right? So, and other, and temperature, climate factors, all of those types of things. Now, the beauty in the environment is some of these things we can change, right? So if we think about housing and neighborhood and crowding specifically, these are factors that we have control over. This slide shows the dynamics of spread for a disease with a reproductive number of 2. And this basically means that for each infected individual, they will infect on average 2 other people. You can see how quickly the numbers of infected individuals can increase in this type of a scenario. But the good news is that we can modify this number through our behaviors. So I'm here basically recording this lecture in my home, safely away from everyone else. And what that means is that if I am now a carrier, I'm not going to spread that disease outside of my house. So why is an emerging disease so much greater risk to a population than an existing disease? A big part of this reason is that it encounters a population that has no adaptive immunity within it. So all we have are those kind of innate responses. You can see that in the rapid spread in the top part of this figure, where the population has no immunity, and in contrast, in the bottom, the disease hardly spreads at all, even though there are, of course, some susceptible people in the population. So this is the idea of population immunity or herd immunity, so that people who have that immunity effectively block the virus from reaching those susceptible individuals. And this is why we should all diligently get our flu vaccines, right? So if we all diligently get our flu vaccines every year, then we create a population in which it's harder for the flu to spread. So we started this lecture talking about exponential growth curves and the exponential increase in disease cases in Illinois. So what type of pattern do we expect an outbreak to follow? Well, again, it really depends on us and how good we can be at not infecting one another. So the left peak here is what you would see happen if we did nothing and we just let the disease spread with no interventions. In this case, cases would increase very rapidly to a very high peak. Eventually, they would decline as uninfected people become rare. This scenario is the scenario we want to avoid, in large part because it would put us over our hospital's patient treatment capacity, and that's shown here on the dashed line. So if all of the hospital beds become full and all of the medical staff becomes overworked, then the outcomes for patients will decline. The right peak is what happens if we implement the many social distancing approaches that we're using right now, right? So we close the dorms, we teach remotely, we limit our travel, we limit large gatherings, we wash our hands, we avoid touching our faces. All of these factors make the spread slower, and hopefully we can keep that peak below our hospital capacity. And this is what folks are talking about when they're talking about flattening the curve. The other thing you can do is, of course, increase the value of the line, right? So other people have been saying we need to increase our healthcare capacity as well, right? So both of those things are things that we can control. So one of the real challenges with COVID-19 and SARS-CoV-2 is that it appears that it can be spread by people before they get symptoms. And that makes it very challenging to control. So this figure here is showing day one where person A is infected, but they don't have symptoms yet. And so they go about their daily routine. They take the train to and from work. And in doing so, they expose other people. Now, on day 2, they develop the symptom of a fever, but individuals have already been exposed and would need to be tracked down and hopefully prevent further spread. So what if instead of person A going to work via the train, the governor of their state has told them, you need to shelter in place? So this person looks up online and figures out that, hey, he's actually still allowed to go fishing by himself under this order, because even if he's a carrier, he's not going to expose anyone. He's got his dog here with him, right? So he does that instead. And so now when he develops a fever the next day, no one has been exposed, and thus it's limiting the spread. Of course, other approaches to flatten the curve include limiting travel. So in China, for example, this was very effectively done with whole cities locked down, thus containing the spread. Given the U.S.'s very interconnected and mobile society, flattening the curve here is more challenging, right? But obviously, one of the things we do see, right, is increasing travel restrictions so that places that do have high levels can be contained. Now, over long periods of time, we also should see declines in spread, right, as more individuals who have adaptive immunity increase. And there's still a lot we don't know, right? So we don't know how long people's adaptive immunity will last. Hopefully, we will be in a case where once people have been exposed to either a vaccine or the virus, they will have long-term immunity, but we don't really know if that's going to be the case yet. Right now, we also don't have blood tests to look for antibodies in people's blood. If we could do that, that would also be really helpful, because if scientists can develop a test like that, then we can say, okay, this person does have adaptive immunity. They're safe to travel and work in areas where they might get exposed. So ideally, over the next year or two, we can develop an effective vaccine that can produce adaptive immunity in people, as well as limiting the spread of COVID-19. Okay, thanks for listening. Feel free to pop me an email if you have any questions.